physician and executive director of the Committee to Protect Medicare. And so, Dr. Davidson, here we are again, reporting on these upticks in cases and hospitalizations. What do you think it's about right now? Is it fatigue? Is it colder weather driving people indoors? What do you think?
I mean, I honestly think we have a huge chunk of our society that's been listening to the president, listening to the governor of South Dakota, thinking that, hey, as long as I have my freedom not to wear a mask, as long as I can get together with my friends and play video games and have dinner, then I'm happy. Well, they're happy until they end up in the hospital. Right now, we're seeing critical shortages of beds. We have shortages of staff to staff those beds. And the actions we take now will impact what happens 3 weeks from now, but what on earth are we going to do for 3 weeks? We don't know around here. We're going into surge capacity. We just hope we can hang on. And I wish people would hear more of these stories so they would just listen to the basic science.
Well, listen to this. There was an emergency room nurse in South Dakota who told CNN just yesterday that she has patients on their deathbeds, Dr. Davidson, still denying that the virus is real. Have you heard of anything like that?
Well, I've not heard of that as dramatic as that, but I've certainly had patients come into my emergency department who tested positive for COVID, and they didn't deny they had it, but when I asked them their behaviors, they said, oh yeah, I've been going out with friends. So yeah, I really don't wear a mask. I don't think they work. I've heard that they might make you more sick. And so despite knowing they have this, despite getting hospitalized, despite being on high flow oxygen, they still just sort of think, everything they learned from the president and his allies, that is what must be true. And it's just demoralizing as a healthcare practitioner for 20 years, as someone who just cares about my community, it's really demoralizing.
Hopefully it clicks for them once, people like you have treated them and they wear more of these. Joe Biden, he said pretty bluntly yesterday in that press conference that the current obstruction of the presidential transition and his lack of access to classified briefings, lack of access to, COVID distribution information could cost lives. Do you agree with that?
Absolutely. I mean, they have plans to increase rapid turnaround testing, which we desperately need. We're now waiting 5 to 7 days for a test to come back. You can't test and trace when you do that. You have people walking around infecting, the whole community before they know they were positive. And if they want to be able to do this on day one or as close to day one as possible, they need to get in there. They need to see what's happening, and they need to be prepared to hit the ground running. It's the only hope that we have now, 64 days away from inauguration, and we need them to be ready.
Let me ask you about President Trump's controversial doctor on this coronavirus task force, Dr. Scott Atlas. I know, I see you shaking your head. You know where I'm going. Over the weekend, he went after Michigan's new restrictions to slow the spread of the virus. And you are there. You are in Michigan. Let me read his tweet. He said, "The only way this stops is if people rise up. You get what you accept. Freedom matters. Step up." And so now Stanford, where Atlas is this senior fellow, is now coming out against his comments. Do you think that's enough, Dr. Davidson?
No, they need to can him. One of the things I can't wait for when the inauguration happens is that he'll be gone. He's a radiologist, which is great. It has nothing to do with public health. He probably hasn't taken care of a patient in 30 some years. He's a right-wing ideologue who is going after my governor, who's doing everything she can despite a hostile state legislature and Supreme Court, and our state who has taken away powers. They're doing everything they can. We know when the president tweeted, "Liberate Michigan," after that we had a plot to kidnap and murder Governor Whitmer and basically take down the whole state government. So now he's tweeting "Rise Up." I mean, there's not much difference between liberate and rise up, and whatever he claims to say, these are call to arms for people in our state, one of the worst states for domestic terrorism. I'm grateful that Governor Whitmer has said, listen, she's not going to worry about her political fortunes, about re-election, or about any kind of attempts against her. She's going to do what's right and try to protect us, and she is.
Thank you for doing what's right and for you protecting people in Michigan. Dr. Davidson, always a pleasure. Thank you very much. Despite being